basis. The hands up that says that some of you were here last year tells me that we're still looking for some answers on how to deal with this situation, and but also when I was putting this presentation together, when I asked me to do it again, to be honest with you, it wasn't much different this year to last year. So some of what we'll see today is will be a bit of a rehash of what we talked about last year, but with some slightly different emphasis. I did look at the questions that are coming through. Some of them I'll cover, some of them at the end we'll come back to and try and that appropriate we'll try and cover. So we'll get to those things this afternoon. So where to now is the sort of title of this workshop, and I must admit I have found myself thinking about that a bit this year. The brief from Alice was to sort of say what's happening locally, and so there's a bit of a list here, and it's been quite interesting. Last year we saw, so when sort of what I'll say at the start of this drought, we actually had a lot of people sort of caught unawares, and so we saw a lot of skinny animals that on farms that wouldn't normally have a problem, and so that people that hadn't necessarily supplementary fed hadn't got their hay reserves in order, hadn't made decisions about what stock levels they were going to run. And at the talk last year, we talked about that as something that's really important, and at this point, it's almost a little bit late, but you can still make some decisions. And what I've found this year is people have already sort of got some awareness around that. So you've been out there buying hay to feed the animals because we had a really rubbish spring and summer, and then a late break again. And so people actually generally have been prepared, but what we haven't been prepared for really is for it to go on quite so long, and then to have such a difficult time sourcing feed. And so what we're seeing this year particularly is the stress on pockets, trying to sort of keep up with what the animals need, particularly, I was talking to Alice before, but particularly around like the capacity to keep feeding stock and sort of keep on putting hay out, keep on finding it, and then keep on feeding it and keep on putting it out, especially if you're not on farm 100% of the time, which some of our clients haven't. And so what we've actually seen this year, which is where I've sort of got down the bottom there, sort of the human cost, the conversations that we've been having with people about what they do sort of going forward, and then how they're going to manage with less stock on the place, or in many cases some of our smaller properties have completely destocked. They've just decided it's too hard and made a decision, sometimes early, sometimes a bit late, because their cows are now skinny and not worth as much, or their sheep in the same boat. And so, although for me, like we'll talk about the sort of standard things, talk about trace elements and that sort of stuff. For me this year, one of the real challenges has been helping people navigate their way through this. And I can see that there's a lot of faces in the room that are looking for those same answers. And I think hopefully we'll provide some answers for you today at least. So just working down that list, I've started at the bottom really, but reduced pasture and fodder availability is what, from a veterinary point of view, we're not just seeing sick animals, we're sort of seeing that as a key nutritional stress for the stock that we're dealing with. Metabolic diseases, weight loss, worm issues, although the worm issues actually haven't been such a big problem as they were last year, but sort of early in the season that was a problem, but I can see that with, particularly with grazing on low pastures heading into spring, it's something we really want to be prepared for. Plant toxicities, we see that in years like this where cattle are scratching around looking for feed where there's not feed available, so things like caterpillar or south-salt, ryegrass, which came up before, those sorts of things may be an issue in this sort of situation where they wouldn't normally be in a good year. And yeah, as I said, the fact that everyone's expressed And I think, and Penny said as well, like there's, if you're all feeling a bit buggered with the way the system's going, you're not alone, and I think it's a really common story out there, unfortunately, and we just hope that this season finishes better than it started. Right, so what I'll do, I'll just sort of run through some key things. We'll look at cattle that have been calving through autumn and what they're dealing with at the moment. Then we'll look at spring calvers and what the challenges are likely to be. Some of them are fairly similar. And then we'll look at sheep and some of the challenges there. And what you'll find is that what I sort of would really like you guys to take away from this is, yeah, there's diseases that we need to deal with and you need to be aware of and what you might need to do with them in the initial instance. But the other side of it is preparation. I know Colin's going to talk about it and I'll touch on it. Things like trace element deficiencies or preparing and avoiding trace element deficiencies is going to be a really important part of keeping the animals sort of maintaining some weight through the next couple of months and through the next 12 months. And also the type of feed that we make available for. So things that we're going to see, so milk fever, grass tetany, downy cows. So we're already seeing that at the moment, cows that are skinny, and what we're often seeing is either sort of sudden death with some of these cattle. They're just too underweight, and they didn't cope with the cold weather that sort of came through a couple of weeks ago, or it's just on a knife edge, and then some other nutritional stress or some other environmental stress comes along. Those animals go down, and once they're down, they just struggle to get back up again. Something we see more commonly in sheep than cattle traditionally, but this year we've seen it in a number of cattle. And these are property owners that are, as far as they're aware, they're feeding out hay every few days. They're putting, trying to put feed in front of their cattle. But when we actually look at it, we find that the amount of nutrition they've been offering their cattle is nowhere near enough, and that's just a lack of information or education. And in some of these cases, there's been multiple animals involved. We've gone out and done disease investigations, and really all we've found is a lack of nutrition, unfortunately. Poor weight gain in young stock, not necessarily a veterinary issue, but it's an issue with this type of season. Trace element deficiencies, as I said, are really common. Again, with the lack of pasture and the lack of availability. The thing with that is that when you've got issues with low trace element in your cattle or sheep, you just don't get the growth rate. So they're already stressed, and their body just can't cope with the nutritional inputs that they're getting in a way that allows them to gain weight, particularly young growing stock. Grass tetany, as I mentioned that up there before. Phalaris toxicity, I know Tim's going to talk about this, but again, in years like this, when we're putting cattle onto Phalaris, which is generally a good quality feed in the area, it's something that we utilise a lot, but when there's a large demand on the grass gets stressed, particularly at times like this where it's slow to get going, then Phalaris toxicity is a lot more common. And again, we've got clients that have sort of had seen that and lost sort of significant numbers of their flock. Haven't seen so much in cattle this year, but we probably will later on, but certainly in some sheep. And some other toxicities which we'll talk about. And some of the options that we've got here, obviously supplementary feeding. I've got up there cereal hay, protein, vegetable hay, if you can get it. But I think if we're really struggling with hay supplies, we're going to have to start looking at actually whether we can use grain or pellets as a supplement in both cattle and sheep, and how we would do that, and how we would do that safely. It's particularly with cattle, it's not just a matter of putting stuff out on the ground and hoping that they'll behave themselves and only the desired amount. So particularly with young stock. So what's a practical alternative to hay if we can't get whole hay? I mean, what we really want is some pasture to be grown, but in the short term, I think we're still potentially weeks away from that in this area. Early weaning, Again, Colin's going to talk in some more detail about that, but that's definitely an option that's been utilised quite extensively over the last few years. It's got its challenges again. Weaning the cattle early, weaning calves early is something that you can do. You've got to manage the young stock after that in order to get decent growth rates, and it can significantly impact when you sell those animals compared to if you're normally weaning it, say 10 or so months direct off the cow, or if you start weaning it 3 to 4 months, how long is it going to take that calf to grow out to actually be a saleable animal? It might be significantly longer than it normally would be, so then you've got potential cash flow issues. Talked a lot about this last year, and we'll talk a lot about it again. Trace element testing, know what you're dealing with, so that you can know what to supplement. This year we're seeing copper deficiency where on the Fleurieu we almost never see it. So there's clearly some issues with how our grass is growing, where the supplements are coming from. So if we're feeding a lot of hay that's from copper deficient areas, then our stock aren't going to get that, for example. So where normally I wouldn't be advocating copper supplementation very often at all, this year we're actually having to look at it and see what the stress points are. I'm just going to quickly go through some of these things and some clinical signs so that you're aware of what you're seeing if it comes up on your property. So hypocalcemia or milk feeders is a low calcium issue, tends to occur most commonly very soon after calving or at calving. We don't tend to see it we see it more commonly in dairy crossbreeds than we do in straight beef breeds, but older, particularly European breed cattle can certainly suffer from this as well. And again, when we're dealing with feed where feed is fairly light on and or restricted, calcium absorption into the body or calcium demand in the body can decrease, and so then we're more likely to get this as a problem. Grass tetany, that's low magnesium and low calcium at the same time. This causes seizures. These animals can die quite quickly if they're stimulated. They can be quite challenging to treat unless you get onto it early. It's relatively easy to prevent generally. Okay, so we tend to see it on lush green pasture, which we have got a whole lot of at the moment. But if we do get that, generally either supplementing with magnesium or even easier just supplementing with hay is an effective way of minimising the chance of grass tetany on properties. The problem is this year we're not necessarily going to have that hay to provide those cattle, so it's something that you want to keep an eye out for. So being really prepared, making sure you've got some magnesium supplementation available. There's big box out there which are reasonably useful, that can actually help prevent that. So having that available beforehand, using things like your vitamin A, B and E injections to help mobilise calcium to keep that going can all be really beneficial things pre-calving and when you have so with hypomag, it's often cows that are lactating, got reasonable sized calves on them and are under a bit of feed stress, and then popping them onto some nice, decent ryegrass pasture. Low phosphorus, often that looks a bit, these are down cows. Again, we're seeing that this year where we don't traditionally see many cases, so these are animals that just have got weak, often low dry matter intake for a prolonged period of time, and their phosphorus reserves run out. The other thing that's happening nowadays, a lot of people are going away from your traditional fertilising regimes, so the phosphorus levels in feed and soil is decreasing as well, and so there's a bit more stress on the animals in that space. So quite often those animals look right, they'll eat and drink, they just can't stand up, and the only way to really work out what's going on there is to do a blood test. And pregnancy toxemia or ketosis, pretox is really the sheep term, but these are cattle that have got stress at calving, lost a lot of weight or are quite overweight, and starting to break down their own body tissues as a nutrition source. Again, those animals will often be quite challenging to recover. So just quickly going through like downy cows, this is the other thing, this one I touched on before, these animals that can be post-calving, can be post-bulling injuries. And I was actually talking to someone earlier this afternoon that talked about, as the cattle are lighter this year, and their bulls are bigger, they're getting more injuries associated with mating. So bulls actually injuring cows during the mating process. So it can also happen when cows are being, they're being ridden a lot. So actually damaging the tail, causing some paralysis down the back of the legs, and actually, in some cases, those animals find it really difficult to stand. Sometimes you'll see them and they'll sort of be knuckling on their back legs. So this is another thing that these are things that are uncommon normally, but in years like this we're seeing more often. So your downy cows can be really difficult to manage without some sort of assistance. So generally they hip clamps, that sort of thing, to try and lift them. If they're down for more than a couple of days, they can be incredibly difficult to get up. And quite often you have to make a decision early on in the process as far as whether we're going to persist with them or not. Some plant toxicities that we will see or are seeing. So Phalaris, we've already seen some Phalaris toxicity issues. This is an issue when the grass is short and stressed, so quite often it's being grazed or it's just starting to grow and the stock get out on it, and the endotoxins in the grass will cause either sudden death or sort of a deteriorating paralysis. So there's sort of two forms. There's a sudden form where you get seizures and death fairly rapidly, and then there's a more chronic form where they take in the toxin and gradually over time those animals get weaker and weaker to the point that they can no longer stand and need euthanizing. Cobalt supplementation, oral cobalt supplementation can be a really useful preventative. It's not foolproof, but it's pretty effective. Generally that means cobalt bullets as a way of doing it. But once you've got it, it's very difficult to treat. It's basically impossible to treat. So the two ways of managing that are to make sure your grass is at the right stage of growth before you start grazing your animals on it, or using those cobalt supplements as a preventative. Again, Tim's going to talk a bit more about Phalaris. Bracken fern. Again, in a year where there's plenty of feed availability, generally not an issue, but in a year like this, if your animals are scratching to find green pig, and young animals are bandits for this, so quite often it's particularly the tall bracken fronds that cattle don't eat because they taste rubbish, but the little rhizomes, the little small little plants that are just coming out of the ground once we get a bit of rain, get a bit of growth. Young stock in particular, if they're looking for feed, they'll start eating those, and the toxins in them are quite dangerous to stock. They'll cause either bone marrow suppression, or you can end up with a thiamine deficiency, and we'll talk about PM in a minute, but that causes seizures and blindness. Cape tulip, last couple of years we've seen significant amounts of Cape tulip around the area. If you know you've got it on your property, then making sure that you're able to keep stock off of that country, or try and poison it, try and get rid of it off the property. But again, it's something that we see in seasons like this. A couple of years ago, in fact, while I was doing a bit of prep for this, I found an article. We had a farm that lost close to 100 animals over a few days because of access to Cape tulip in an area they didn't normally graze. They got into some bushland, and over the best part of a week, they lost most of them off of cattle. Quite horrendous to see. There's no treatment, so avoidance is the key there. And soursop, I've just noticed in the last few weeks. So soursop is one of those things that generally is considered pretty innocuous, but this year I've just started seeing quite a lot of soursop in areas where I wouldn't normally see it, including our own place here in Tumbles. Now, and we've already seen, I'd say, half a dozen sheep with sow salt toxicity, and one steer actually that ended up dying from it as well. So it's an issue when there's not a lot, when the sow salt hasn't got competition from other grasses, and cattle will just nibble on it. It's tasty enough for them to give it a go. They don't need a whole lot of it in order to cause problems. It can cause, in acute phases, it can actually cause hypocalcemia or milk fever. The oxalates in the plant drag the calcium out of the body, and so you get sheep in particular going down with it. We see it more commonly in people that are running sheep in vineyards. So in those interrows, they'll quite often, you put some pasture down with, on that real clay sort of soil, we get a lot of sow salt there. And that's where we most commonly see it, but I reckon this year we're just sort of seeing it randomly in places that I wouldn't expect. So it acutely causes calcium deficiency, but long term, the crystals that are in the bloodstream that end up getting filtered out by the kidneys and you get kidney disease. They can recover from that over time, but in many cases, these animals, or a percentage of the animals will die. So I guess what I'm saying is just be aware of sow salt as a potential toxic plant. Don't sort of ignore it just because it's something that you see relatively often. In a tight year, it's definitely something that's going to cause issues. Some other incidental sort of things that we're seeing this season. So calving issues and retained memory. So we're just seeing more. So it's interesting here because of the season. A lot of the calves are smaller, and so the actual challenge of getting them out of the cow is not so high. So we're not actually pulling so many calves this year. But what we are is seeing issues post-calving. So more likely to get mastitis because their immune function's a bit poor, more likely to get retained membranes, more likely to get uterine infections afterwards. So again, it's associated with the fact that they're not getting the vitamin intake of and the nutrition out of green grass, basically, that you would normally expect. Woody tongue, so that's what this picture is here. So it's a cow that's got a very swollen tongue or has woody tongue. So we're seeing that this year, again, associated with feeding of poorer quality roughage, feeding on stubble, and also just cows eating things that they wouldn't normally eat, like Xanthoria and that sort of stuff. They're just sort of picking at stuff they wouldn't normally have. So they'll cause injuries to the tissue around the tongue, and infection gets in that way. And the same with lumpy jaw, just eating close to the soil, ingesting material that they wouldn't normally eat, and taking and getting the bacteria into areas that it shouldn't go. So lumpy jaw is an infection of tooth roots, or the jaw, where the tooth has fallen out and comes out, the bacteria lives in the soil. So it's one of those things again that we're just seeing more of. And foot rot, because we've now got some rain and we've got some mud, but we haven't got a lot of grass as protection. We're just seeing more cattle with interdigital dermatitis or foot rot than we normally would. So again, just things to be aware of as part of what's going on in the season. So spring calvers, so metabolic problems for them, so hypocal and low phosphorus as well, and grass teddy potentially, down cows, so pretty much the same sort of things. And again, looking to supplementary feed where you can, particularly in order to try and avoid things like grass tetany, and have prevention in place rather than sort of trying to fix them. Again, it's going to be a bit of a challenge this year. And down stock, we're going to see poor weight gain in these, and the thing that's going to, from a veterinary point of view or a disease point of view, these animals are just going to be more susceptible to the common things that we see. So, more likely to get issues with lice, they're more likely to get ringworm, more likely to get sea warts, probably more susceptible to things like pestivirus and that when it's floating around and the impacts of that. So, and also if they're really grazing pasture that's very short, they're definitely more likely to end up with worm issues. So that and plant toxicities because they just eat things. So we're just, for the first time in 30 years, I'm raising a calf this year. It's the worst year to do that. But just actually enjoying watching it do all the stupid things that calves do, eating bits of pine, eating soursop, which is one of the things that I noticed that we do have, soursop in our area. We had a burn off last night, and she just stood way too close to the fire and decided that looking out would be a good idea. So my point really is that young calves do all sorts of things that are really dumb, and they're more likely to be susceptible to things like your bracken toxicities or your other plant toxicities. So just be aware if you're weaning your calves off early, if you're trying to manage them differently, just be aware of where you're putting them and make sure that you're not actually setting them up for issues. Okay. Are we going for time, Penny?
Depends how many questions you want.
Okay.
Another 5 minutes,
Okay,
10 minutes
go on.
maybe? Yeah.
Yeah, all right. So I'll flick through this fairly quickly. So the sheep, because I know there's a lot of sheep farms out there, so the things that we're again seeing, so we're seeing sort of our lambing rates and our twinning rates are down this year. Okay, so that's a bonus, but we are seeing, and also just the ones that are a bit light on and are just struggling to get get lambs out. They're more likely to prolapse. So we're seeing those sorts of issues this year. Pregnancy toxemia this year, actually last year was a really common thing. This year people are, they're feeding grain, feeding supplements better than last year. So we're not seeing quite so much of that, but it's still a risk if you're not making sure that you're prepared and have your feeding in order. High worm burdens, we're not seeing that right at the moment. We saw a lot of that sort of February through to April, and a little bit of rain sort of February, just a touch of rain, we saw a real increase in the worm levels, particularly in hobby and our sort of smaller acreages. But also some of the bigger farms were reporting as well, so definitely something that was an issue earlier in the year and quite likely to become a problem in spring as well, once the weather starts to warm up. Acidosis from feeding out too much grain, it's maybe not too much grain is the wrong term, but inappropriately feeding it out, so where there's not feed limiters or physical limiters or mineral limiters in the feed to prevent the stock from eating too much grain all at once. People are trying to do the right thing, obviously, by supplementing that, but then end up with sheep getting really crook on that, particularly young sheep, weaners and that sort of thing, just going too hard on the grain and then getting diarrhea and either dying or really struggling for a week or two. Again, trace element deficiencies and PEM are two others that we're seeing. So pregnancy toxemia, just very quickly, it's weakness before lambing, weight loss and appetite. So they go down and then they stop eating and then they don't get back up again, basically, pre-lambing. It's hard to treat without inducing them, and it's often used that are twinning or have triplets. So managing pre-lambing feed is really important. PEM is the low thiamine levels in the feed, or in things like bracken which have got thiaminases in them. Causes blindness. That sheep there sort of head back, trying to work out which way's up and which way's down. So they get blindness, then weakness, and if we treat them early, they'll respond really well. But if you wait too long, they definitely won't. And our high worm burdens, pretty straightforward. Most of you have seen this sort of thing before, but it's a much bigger issue when we've got a lack of feed. The closer we feed to the ground, the closer those worm larvae are to be picked up by the sheep and cattle, and the more likely you are to get higher worm burdens, particularly in your young sheep. So a lot of you will have the running sheep or the finished lambing or just be in the process of lambing at the moment. Once spring comes along, if we don't get decent spring rains, we don't get some decent growth, then the risk of this grows significantly. Using, testing whether your drench is working is also really important. We see drench resistance as a really common problem on the Fleurieu in sheep. It's something that is relatively straightforward as far as seeing whether you have it or not. Basically involves taking one a big leg sample prior to the drenching, and then 3 weeks later, 3 weeks later, taking another sample and repeating that worm count and making sure that the drench is actually working. What can we do? So we touched on trace element testing. So this is something that I think in years like this, it's really, really important. If you don't know what's happening on your farm, you don't know what to treat with. So treating for trace element deficiencies requires a knowledge of the point that your animals are at the moment, so you know whether they need supplementation or not. And as I said, this year we're actually seeing where I traditionally would have said that issues around copper in cattle, sheep it's a little bit different, but in cattle we rarely see in this neck of the woods. We're definitely seeing it this year, so making sure that you understand what's going on. It may be that the treatment regime you've been using for the last 5 years actually isn't appropriate this year. Okay, so if you've been regularly testing, great. If you've been regularly supplementing, then that's also good. But you do want to make sure that supplement's actually doing something and it's appropriate for your stock in a year like this. So absolutely advocate doing that. That's either bloods or liver biopsies, both at their place. As a screening blood testing is a good place to start. Nutrition. I think this year we're really going to have to look at some of the supplementation we've got available. I know there's a big load of hay delivered, support hay delivered here a couple of weeks ago, and then there was a significant concern around the quality of that hay and some of the advice that people got to go with it, including sort of adding urea in as a way of building up protein in some of those hay supplements. So knowing what you're feeding is really important. The use of things like urea is something that can be done. We want to be super, super careful with it because it can also be quite toxic to stock. Make sure that you aren't picking up your grain supplements either, your mineral supplements, either your mineral blocks or your stuff like Magforce or some other product, either with the feed, on the feed, in order to make up for the stuff that they're really not getting because we're not getting grass. Vitamin A, D and E injections, we like that product a fair bit in this sort of year. Fat soluble vitamins are generally only available through the green grass, and so particularly at times of stress like calving and weaning, that can be really helpful. And use of, like knowing with the fertility bulls, using high fertility bulls so that your animals that are already under stress have the best chance of getting back in calf next year, and rams, I should say. Yeah. And the 3 take-homes. Trace element deficiencies, I've already harped on about that. Metabolic disease, I've already talked about that, and plant toxicities. So they're the 3 things that we are seeing, and I would say the most cautious of. Now I've got on the phone, I did take some notes for the questions, so some of the ones that are up there, so I can find it again. So someone asked about trace element supplements. Is there, whoever that was, is there anything more that they wanted to know other than what we've covered so far?
Yeah. What's your take on feeding glucose? Is that?
Okay, so as a supplement, that's not a trace element supplement though, but as a feed supplement, it's good high protein, and so as long as you're able to do it in a way that basically overdose on them. So these, I guess it also depends on whether they've been milled or crushed or whole lupins, that sort of thing, as to how safe they are to feed. But as a sheep feed, they're really good. Yeah. And as a cattle feed, we don't tend to use it very much, but as a sheep feed. Yeah. So ryegrass toxicity, someone wanted to talk? Yeah.
Well, it was the Polaris, but you actually did help us.
Yeah, cool.
Really well
How are
with
you?
that,
Yeah.
and you answered the questions, and we did put them out, in particular, cutting too soon.
Yeah. Yeah.
And we thought it would be fine, but also we've given them the cobalt
Yeah.
bullets that we recommended.
No, good.
The surviving ones look great.
Fine, yeah. Yeah, I mean, one of the things that came out of that conversation, particularly is how hard it is to tell the difference between some of those diseases that cause staggers, so ryegrass versus phalaris staggers, for example. And sometimes the only one way to know is actually, you know, to do a post-mortem and actually take the brain out of the animal. The important thing with perennial ryegrass staggers, which is probably the most common we see, although earlier in the year, they will recover from that, whereas from phalaris or the annual ryegrass toxicity, the recovery rate's far less. So yeah.
Yes, Simon, how many sheep do you need to see with symptoms before you worry about it?
I guess probably there's a percentage. So are we talking about phalaris or ryegrass?
I'm just saying symptoms of staggers, like is
Yeah.
it a lamb that is all of a sudden sort of going a bit shaky in his legs?
Yeah, so if it's just a one or two, like out of a big lot, I probably would monitor it. But if you're getting like more than a couple of percent, I would be saying that's a problem. You know, so it's from a trigger point of view, I think, and if you're getting consistent findings, the thing to sort of consider, like that might just be the tip of the iceberg. So you might be seeing some neurological disease in those individual, a small number of individuals, but we don't know what the impact on growth rate, for example, is on the rest of the mold. So yeah, so it wouldn't, for me with neurological disease, the trigger point's not very high. So if I saw more than 2 or 3, I'd be jumping at it. And by then, I don't think, is there anyone from Perth here today? Anyway, I'll do the Perth group. They are really helpful. They're really helpful at providing support for us as vets to get out on farm, and then if it's neurological, quite often you can actually get the full post-mortem done at very minimal cost to the producer, and I'll first of all fund all the lab tests and all that sort of jazz. So I think if you're getting stuff like that, I would get in early. There's support available. We talked about support before, but there's support available to work out what's going on and actually deal with it earlier rather than later. Good question. So I put my phone away now. I'm so old nowadays. Looking around, there's a bunch of old fellas all talking to you guys this afternoon, and some very well, much younger women doing all the getting all the energy going. So.
I'm glad I've been called young.
Same.
It's all relative. It's all relative. But
Make the day.
pain relief at landmarking, I think. What did you do on that? That's a pretty quick and easy one to answer. So there's a few different things out there. There's some lidocaine or local anaesthetic options that are available. Numbnuts is the main one out there. Very helpful in the first hour or 2 after marking, but not much help after that. So something like, I don't mean to speak particular brand, but something like meloxicam, which is a pain reliever, really effective, lasts for a couple of days in sheep. There's lots of studies showing that it's effective at reducing the pain and any sort of weight gain issues that you might see with landmarking without any pain management.
It's a product called Butec that's available in rural stores.
An oral one.
Yep,
Yeah.
Oral.
that's
Yeah.
oral.
Yeah. So there's injectable ones and oral ones, both available. Yeah. So
Is Flexicam an injectable one or an oral one?
who's what, sorry?
And Flexicam, is that injectable or?
I've not heard of
Meloxicam.
Meloxicam, that's injectable.
Meloxicam.
Yeah. So yeah. So there's a few different sorts. Just got to make sure that you're getting the right duration of action. So there was people using what was the mulesing stuff?
Trisulfan?
Trisulfan, yeah, with limited effect. In our experience anyway, we just found Bloxcan has been really effective.
Trisulfan's purely topical.
That's right, yeah. So, I didn't find it lasted long enough either.
Better than nothing.
Yeah. And the last one, have I still got time for one more?
One more.
Yeah, risk of prolapse. Someone asked about risk of prolapse. Was that used? Is that
Yeah.
yes? Yeah. So what were you just wanting some?
What's the cause of, like, what causes them to actually prolapse? When are they at risk of, like, mainly to that?
So there's a few different causes. So there's been some work to suggest that low selenium can have an impact on that. In my experience, one of the major causes is just tail docking too short and genetics. So I'd like some input from anyone else if they've got other theories. But yeah, we're mostly, particularly maidens, we're seeing it where the tail ducking's been done shorter than it should have. So there's a bit of neurological impact, and certainly some animals seem genetically more prone to it. So you really should be seeing it in maiden use though. So, that would be a worry. Thank you.
Can we give someone a round of applause?